Well, hey neighbor, it's me, Angie. Come on in. It's time for our neighborhood chat. Yeah, I know it's it's late, but I'm making the video today. Today is Sunday. Yes, it is. Um, Today our neighborhood chat, I'm gonna talk about me going through the test or not going through the test that I had the other day. The feelings that I had, what I went through that I hadn't been through in a long time, and maybe it'll help someone else as they are going through things in their life. But as a lot of you know, I was scheduled to have a CT scan on my heart, and the morning came for me to do that. And I got up, and in the back of my mind, something kept telling me, you might need to take a Xanax. Well, a doctor had not prescribed me to take one for this test, so I thought, no, I've done this test before and I made it through it, so everything will be fine. Didn't think anything about it. Well, I get up there, and the lady takes me back. She wouldn't let James go back with me because of the radiation from the CT or something like that, which was fine. She takes me in this room, and she has to get some blood to test my kidneys to make sure my kidneys will be able to take the dye. And so she takes a little blood from me, tests my kidneys, and they're fine. And I tell her, I said, I'm a hard stick. I'm hard to get IV started. She did it just really quickly, got the vein, everything. I was like, okay, this is going good. She got the line in for me to get the dye, and we go in the room where the machine is. She pulled me in there. She's like, does this look familiar? I said, yeah, I've had this. I can do this. But before, they laid me down this way and scooted my legs in first and then got up to my chest. Well, this way they were going to lay my head right near the circle, the machine, I call it a donut. And I said, I've never laid that way, but I don't think it'll be a problem. So then she said, can you sit up on the bed of the, where they were doing a test? And I was like, no, I can't get up there by myself. She said, okay. So she calls this guy in there. Well, I have to stand up and then hold on to someone to move around. Well, instead of doing that, he just automatically starts pulling on my arm for me to stand up. And I say, no, you can't do that. You're going to have to wait a minute. I've got to stand up, and then I'll hold on to you like I do my husband. And I'll turn around and I'll sit on the bed. And he never says a word, never says anything. But I could tell, how you can feel something off people that you just get this, they're just kind of like, okay, whatever. So I get on the bed and I sit down, and he says, put your feet on the table. And I'm like, I can't do that. Someone's going to have to help me. So he picks both of my feet up at the same time and just slams them onto this table. Okay. So I'm like, oh, wait, I didn't get on the table good. He said, oh, well, that doesn't matter. We can fix you with the sheet. It's like, okay. So they get me situated on the table because I can't move from the waist down. Except I can move my left leg a little bit, but my hips do not move right. They don't move at all. So the lady says, well, I'm going to put a pillow under your knees so your back won't hurt so bad. Because I expressed to her that I couldn't stay on that table very long because my back would hurt. She was really super nice. I cannot even remember her name. She told me her name. Had curly hair like Berkeley. I mean, just really a nice lady. So they get me situated, and he starts pulling me through, like get the machine to start pulling me through the donut. He said, can you put your hands over your head? I'm like, yeah. So I put my hands over my head, and he puts me on through the donut. And I make it through fine. I'm good. They're still talking and everything to me, and seems like everything's good. Well, all of a sudden, without any notice, he didn't say, I got to lower this machine, I got to do this. He didn't do anything. All of a sudden, he just hit this button, and that machine came and touched me right here. Well, all I saw was this equipment sitting up on top of me. And they kept talking and wouldn't come on and like administer or anything. Well, near the time they're talking, my mind starts going like, oh no, they're talking and I'm trapped and I can't breathe and, you know, all this stuff. So I start saying, I can't breathe. I can't breathe. Well, I could breathe. I was talking. And I was saying, I can't breathe. Take me out. Take me out. Take me out. Well, the lady said, get her out. So they pulled me back through and set me up. And I'm panicking. I'm crying. I am just losing it. This is something I hadn't done in I don't know when. I don't think I've ever had a panic attack this bad. So I sit there a minute. She looks at the man and she said, you want to give her a minute and maybe we can try again? And he's like, no. And I said, okay, fine. If you don't want me to calm down and see if I can do it, what? Okay. Which I don't know if I would have been able to or not, because my mind had went way south, thinking that I was being buried in a coffin and all this stuff. Buried alive is what I felt like. So they put me back in the wheelchair and everything, take me out there, tell James I didn't get through the test and all that. All the way home, I was like, all I had to do was wait 10 minutes. 10 minutes for them to administer this test. That's all I had to do. And I was just beating myself up really bad because I didn't get through with the test. But I want y'all to know that anxiety and panic attacks are real. They are very real. I never even had one until years ago, and it wasn't anything like this one. This one was really, really bad. And I had told both the doctors, now, if you're planning on doing some kind of test, you're going to have to put me in a twilight or give me something or something, because I just don't know if I'll be able to do it. It wasn't like I didn't tell them. And on top of that, I'm a lot larger than I was when I had the first CT. And when I went through the little donut thing, I could feel the little sides of the machine. You know, that's how small it was. And I was trying to tell myself, it's okay. And then when I did, I went through the machine and I was on the other side of it. And I was fine until they pushed it down and it was like they locked me in. And I really beat myself up over it, that I didn't make it through the test. I know I'm going to have to do it again. Next time I will take something from home. If they don't prescribe me something, I will take something here so I can get through the test. I don't know what they're going to do. I got the thing today showing where they showed on my chart where you can go in and look at your test results and everything. And it said test aborted because of the patient's claustrophobia and anxiety. I just thought that was funny. I aborted the test. But it wasn't funny at the time. But I'm here to tell you, if you suffer from panic and anxiety, it's real. And I keep saying to myself, why didn't I just start praying the minute, instead of saying, I can't breathe, I can't breathe. Why didn't I just start saying, Lord, please just calm my mind down? Or why didn't I just go to close my eyes and just go to a happy place in my mind and not even think about being in that machine? I don't know why I didn't do that. I told my sister today, I said, what I'm going to do, I'm going to take one of those eye masks. You know, you sleep with a mask over your eyes. And the next time I have the test, I'm going to put that on. And when they run me through there, I'm just going to lie there and not open my eyes. And if I did open them, I'd have that mask on, you know. And I wouldn't be able to see that the machine's right there right there on me. And maybe I could get through it if I did that. I'm going to have to. The next option, I guess, is that TEE test, where they will put me in a twilight and they'll go down my throat, which I did not want them to do, which I'm probably thinking he's going to suggest that next. I don't know if they'll try to do this test over again. I have no idea. I can't be the only one that has not been able to take the test. I can't be the only one that's failed it. I'm sure I can't be. But what I want to tell you all is, do not have guilt about having anxiety or having panic attacks. As much as I meditate and pray, it just kind of broke my heart that I didn't turn to that when it all started to happen. I think I got mostly upset when they started, the way I was put onto the table, the way they picked my legs up and slung them on the table. I think all that had me so focused on the fact that I thought I was going to fall or something bad was going to happen, that I wasn't focused on really praying and getting through the whole situation. Or just going to a place like thinking of a field of flowers, or, you know, something beautiful, clouds, going to see my grandchildren, or just something real comforting. I don't know why I didn't think of that. It just happened so fast. I guess our neighborhood chat would be about, do not worry about having anxiety or panic attacks. Learn to accept the fact that you do, and try to work through each one of them as they come, because up until that point I had not had a panic attack in years, because I never allowed myself to get it caught up in a closed space. And I guess the reason I do is because I can't move my lower extremities, and I feel like I'm helpless, and I can't get myself out. But panicking is very real. And I think the next time I'll probably start preparing way before, and not even really speak a lot to the people that are administering the test, and just really be in a state of thinking good thoughts and calming thoughts, and not even thinking about anything else. I don't look forward to, even now that that's happened, to even being put on a stretcher for them to take me to do another test, to put in a new pacemaker, being put to sleep. You know, I have total confidence that whatever's going to happen will happen. But I don't look forward to it. And I hope each one of you will remember me in your prayers, that as I go through this next month or so, trying to get through these tests and the procedure of getting the new pacemaker put in, that I will find some peace and comfort to not feel stressed or panicky, because that doesn't help any of the situation. It just prolongs it. But I just want y'all to know, thank y'all for your prayers, and thank you all for being here for me. I really appreciate it, and I know that I can depend on y'all to pray, the ones that believe in that. They said they had a couple of months before they would have to really do something, like it would be an emergency. But I want you all to know that I love you and there's nothing you can do about it. I feel like by me not getting the test done, that I flunked a test, like going to school when you flunk a test, or you flunked like your driver's test or something. You just was let down that you couldn't complete something. It's just strange the way I feel about not being able to do that test. It's just weird. But the way I was feeling and the panic that I was going through was very real at the time. After I almost got home and I had calmed down, I thought, why did I panic so bad? Then I got to thinking about it. I knew why I panicked. It's because he let that machine down on my chest without telling me, look, I got to lower this machine and it's going to make this sound, but it's okay because I have to do that. He wasn't talking me through it at all. He was just going through the motions of just doing the test. To him it was just second nature just to switch a button. It was like he was just doing a job and he didn't have any empathy or sympathy for the patient in the CT. Which everybody can't be sympathetic and empathetic. And we shouldn't expect that. And I didn't. It was just that when he tried to grab me out of the chair and then sling my feet up on the table, I was like, oh, this is not going to go well. Hurry up and be over with. This is not going to go well at all. I guess he looked at me as here's this overweight woman in a wheelchair that really can walk, but just chooses not to. See, everybody doesn't know my story. They don't know that I cannot walk. If I could, I would. And believe me, I want to. But a lot of people in the medical field, and even people that are not in the medical field, look at people that are disabled if they're overweight or and they look healthy, because if it wasn't for me, you can't see my sickness from the outside. My sickness is on the inside. So I look like this big heavy lady that just wants to be in a wheelchair that can't walk because she's overweight. And a lot of people look down on that, which I don't really care what people think, but that's the way they do. So next time you see someone in a wheelchair that doesn't really look sick, don't judge them, because you don't know what they're going through. And a lot of times they're going through more than what you think they are. But I've been doing okay the last few days. Just wait next week. Maybe they'll call me and let me know what they're going to do. I feel like my teachers have said, oh my goodness, this woman could not get through this test. But it wasn't like I didn't tell them. I absolutely told both doctors, look, I cannot get through these tests without you giving me something. I guess they thought I wasn't telling the truth or what. But I guess they'll know now, won't they? But anyway, that is our neighborhood chat for today. Remember, I love you, and there's nothing you can do about it. Like, share, become my neighbor. I don't always talk about my illness. I really don't. But I talked about this today because I wanted everyone to know that deals with anxiety and panic attacks. Don't feel guilty about that. Just try to learn more about having to cope with them and deal with them. That's what I'm doing. Especially if I know I panic at tests like that. Now I know it's way bad that I panic. I know just how bad it is. And it's bad. I was losing it. If y'all could have seen me on that table, I was losing it. I was bawling like a baby, saying, no, stop. It was just like, oh, I cannot even explain it. But anyway, thanks for listening to me. Thanks for always being here for me. And I really appreciate you all. Bye, neighbor.